I'm Adrea Bennett, the supervisor at the Breast Health Center at SwedishAmerican Hospital. As we know, in March, the pandemic hit pretty hard, and we did close down for a short amount of time for our screening mammograms, about 6 to 7 weeks. And about mid-May, we started up full force again, and now we are back to normal. We're back in the swing of things. Of course, October starts Breast Cancer Awareness Month, so we're getting extremely busy. And I was just going to talk a little bit about the changes that we've made due to the pandemic so that patients know that it is safe to come see us and have their screening mammogram done, and that it's important to not put that off. And even in light of the pandemic, we're being extremely safe. So one of the things, of course, that we've done is our beautiful accessories. So you can never tell that we're smiling anymore, but we're smiling underneath. So of course, all of our receptionists, everyone that works here is wearing a mask. The technologists that work with our patients are wearing a face shield as well. And patients are being screened at the front of the building. They're getting their temperature checked, and they're going through a series of questions asking if they have any symptoms. Some of the changes that we've made have been in our front desk area, where we did take out the majority of the chairs that we have in our front desk. We're not allowing any visitors, so if anyone brings anyone with them, they do have to stay in their vehicle. They're not allowed to come into the building, just to keep everybody safe, to maintain social distancing, and that's hospital-wide as well. There are some inpatient patients that they are still allowing visitors for, but right now no outpatients can have visitors unless they need them for assistance. We've also implemented little dots on the floors so that everyone knows where they can stand when they're at our reception desk, making sure that they're safe from the people in front and behind them. And then also we've applied plexiglass to our front reception areas to keep the patients and the receptionists safe. We do require a mask for anyone that enters the building, or some type of face covering, and then of course all the employees wear them as well. One other thing that we've implemented just for patient safety is we used to have a shared locker system. So a patient would come in, put their clothes in a locker, go have a seat, have their exam done, and then the next patient would use that same locker. And at this point, we're not allowing patients to share lockers. We are giving the patients, when they walk in the door, a belonging bag with their gown in the bag. So the patient puts their belongings back in the bag and carries that bag with them throughout the department. So your clothes are always with you, your belongings are always with you, so that there's no exposure from someone else's belongings being near yours. It's really important, just like always, to make sure that you get your mammograms on a regular scheduled basis. It may be yearly, it may be a longer extension based on your doctor's recommendations, but we want to catch it early. That's the whole key of mammography, early detection. Certainly as cancers spread or get bigger, they can change your treatment options. So we want to keep your treatment as minimal as possible, and we want to be able to catch things when they're very small.